This is a gross pathology specimen of a slice of a breast tumor, and this is the skin anteriorly, and I will just rotate for you to appreciate that. The skin does not appear to be ulcerated over the tumor. So what we're having is a very large tumor that is bigger than 10 centimeters, and let's look at the edges of the tumor and see how it interacts with the breast. So there we have the skin. This is the adipose tissue of the breast parenchyma, and the tumor is actually very well demarcated. I'm just going to pass this magnifier around, and you can see the tumor is fairly well circumscribed. Here it's got a kind of lobulated appearance. This is the breast parenchyma. Here we have a few of these cystic areas which could possibly represent fibrocystic change. And again over here, it continues to be very well demarcated. We do not see it infiltrating into the surrounding breast parenchyma or into the overlying skin. So we have a fairly lobulated, large, solid, fleshy tumor that is tan in color. And if you look at the cut section, you can see some broad, rounded, lobulated protrusions and clefted areas. Again, you can see it better over here, clefted areas. And this is what gives this tumor its particular name, because apparently the clefted areas appear leaf-like. So this is known as a phyllodes tumor. So this is an example of a phyllodes tumor of the breast. And what does this look like microscopically? Here we can see sort of almost these broad leaf-like expansions, and here again, sometimes it can be seen in a cystic space. And let's just focus on this area. Here again, we can see these broad protrusions that appear quite leaf-like, and these are actually covered by benign bilayered breast epithelium. We can see the myoepithelial layer, and this is the luminal or the ductal layer of cells. Now this actually is a fibroepithelial tumor, so it's similar to fibroadenoma, but there are some differences. First of all, this leaf-like architecture is very classical in phyllodes tumor. Secondly, if you look at the stroma of the phyllodes tumor, we'll see that the stroma is a lot more cellular compared to a fibroadenoma. These two pictures are taken at roughly the same magnification. On the left, we have a fibroadenoma, and you can see that the stroma is a lot less cellular. I'm just going to zoom in compared to this phyllodes tumor. It's a lot more cellular in a phyllodes tumor, and this is one important difference. The other difference is that in phyllodes tumor, you have a more intracanalicular architectural pattern, so you get these broad leaf-like areas, as opposed to a fibroadenoma where the pattern tends to be more pericanalicular, where the stroma surrounds compressed glandular or ductal structures. Phyllodes tumors can rarely undergo malignant change, and it is interesting that it is the stromal component that becomes malignant. So how do we know that this may be a malignant phyllodes tumor? Number one, we look at the cellularity of the stroma. The stroma in malignant phyllodes tumors is very, very highly cellular, even more cellular than this. We also see wide expanses of stroma without the presence of this glandular or epithelial component, and this feature is not present in this tumor. The third thing is that when we look at high power, we can see atypia and pleomorphism in the stromal cells, as well as increased mitotic figures. And the fourth clue is that we can see that the malignant phyllodes tumors tend to infiltrate into the breast parenchyma, and this is not again seen in this case. So just to summarize, this is a biphasic or a fibroepithelial breast tumor. It's got a predominantly broad leaf-like, predominantly intracanalicular pattern with a moderately cellular stroma that surrounds the epithelial structures. There are no features of malignancy in the stroma. This is a benign phyllodes tumor.